Unless it's live now and everybody just heard
Oh,
me.
yes. So we're live. We are here. We are here. Good afternoon, everyone. We are so happy to be here today. April has been an amazing month. One of the things that we've done here at Moms Rising this month is celebrate Black Maternal Health Week. We've been out here jamming all over the country, talking about maternal justice, talking about birth equity. And here we are today to zero in on some powerful work in New York City. My name is Monifa Bandele. I am the Chief Strategy Officer here at Moms Rising. And thanks so much for joining us for this important conversation. If you follow us, you may know, but if you don't follow us, you may not know. But the United States is actually the worst place to give birth in the developed world. We have a maternal mortality rate, which means deaths during delivery or postpartum, that is ever increasing. The Center for Disease Control just released a report that our maternal mortality rate has been going up during COVID. And while most of the world has seen drastic decreases in maternal mortality, some 44% drop, we continue to see a growing rate of complications, morbidity, and mortality for moms who are trying to have babies. And in fact, when you dig a little deeper, just like with everything else, there's huge racial disparities. So, Black women and Indigenous women in the United States nationwide are 3 to 4 times more likely to die during childbirth or due to complications during postpartum. And when we zero in on cities like New York, those stats are even higher, 8 to 12 times higher than our white counterparts to die because of childbirth. And we've got to remember that this data remains consistent irrespective of education, income, and even geography. So we're really looking at a racial equity, racial justice issue when we talk about Black maternal health nationwide and especially in New York City. But just like all over the country, we have champions. We have champions in doulas. There's Black doulas everywhere who are championing survival for Black mothers. We have midwives. We have advocates. We have moms who've had personal experiences who've turned into champions and dads too. And we also have amazing elected officials. So I'm really honored today to be joined by one of my elected officials, because I'm based here in New York, our public advocate, Jemani Williams. Thanks so much for coming to be with us at Moms Rising today.
Thank you so much. Peace and blessing, love and light to everyone. Peace and blessing, love and light to you, Monifa and Mom's Rising. I'm just honored to even be here, and I think I check a couple of those: advocate, dad, and elected. So
And
I'm just
elected. You know, we're always many things in one.
that's
And
a
that's what makes us stronger elected leaders when we have elected leaders that have the experiences that we are having as people, right?
hundred
But
percent.
before we dive into what's happening in New York, the stats, and this amazing package that you're championing, why is this issue important to you? What story brings you to birth equity and maternal justice?
You know, first the first thing is showing the importance of diversity in your organization. You know, I know shout out for Rain who's been helping here, and a real shout out to Jamela Rose, my deputy public advocate, and so many other folks in the office who brought the issue of Black maternal health up to senior management and to me years ago. And so we started working on it, and I thought it was an important issue. And then it hit home. We started working on it before it even became as personal as it has to me. So we're working on this. And then, I got, I like to say that the first miracle is I got married. I am newlywed still, last July. And the week before we were married, found out my wife had cervical cancer. And a
Mm.
week after, they told us that we wouldn't be able to have any kids at all. They had to go in and do a radical hysterectomy. And so we started trying to get eggs and surrogacy and what have you. And she called me one day. She was sick. And we went to the doctor, and she called us and she's pregnant. So who's pregnant? And so,
Right.
uh, you know, but we were both believers in the Most High, and we walk with the Most High. And our beautiful baby got the nursery in the back here. Amani Elisadora was born on February 14th, premature, but 2 months. But praise God, she's doing well. But the whole process, I saw I even felt bad because I would hear the stories that my wife was saying, and I would go to her doctor's appointments where they weren't giving. I didn't know at the time we weren't getting all the information that we needed
Right.
to make the decisions we were trying to make for to have a child. Even tests that we were getting back saying everything was good when it actually wasn't. And the difference I saw when we found a black woman gynecologist who happened to be an oncologist gynecologist when we found her, the difference that I saw personally from what would happen before that until that point after was just remarkable. And I had to, listen to my wife discuss. I'm grateful I have a daughter by marriage, a beautiful, who's going to be 14, Amelie. But talking about her experiences when she was younger and had a first child. And as you mentioned, it doesn't make a difference socioeconomic status, and it shouldn't. But just happened when she had the child, she wasn't married. She was much younger, didn't have a career, didn't have this great health insurance, and still she discussed the treatment she received and
Right.
getting a C-section when in retrospect, that's not what she wanted, to what happened now when she is married, have a great career, have great insurance. Is just, it's remarkable. And praise God that our story ended the way it did, even though it was traumatic throughout. We know of too many people where the story ended with someone lost their life.
It's so many. And also, I just wanted to put a pin right there because, like you said, all along the different experiences that Black women are having, and I definitely want to shout out that Indigenous women also have a really high maternal mortality rate. Um, you talked about your bonus daughter and what your wife experienced having giving birth to her with C-section. I also had two C-sections all the way to now, and her situation was very different, her age, her income level, all of that. We're still not listened to. And it reminds me of when the issue really took fire. We were working on it here at Moms Rising, and the story came across our desk of Serena Williams, right?
Mm,
So here you have probably one of the most well-known Black women in the world. She's definitely wealthy, and she basically said she wasn't being listened to, that her suffering was being ignored in the hospital, and that had she not basically stood up and showed out, that
mm,
she would be with us here today, right? She knew that she had these, but she's an athlete. She kind of knows her body. She knew she needed to scan her body for blood clots, and in fact, they were there, and if they weren't treated, would traveled and killed her. So just like it's really important for everyone listening is that we're talking about a racial justice issue, and definitely is compounded by issues like poverty or being far away from healthcare if people live in rural areas, and all of those other things. Access are important, but at the core, this is a Black women's issue, and we're facing racism all across the health system, but particularly while giving birth. What are the packages of bills that you are pushing in New York City? I know, I think it's two bills and one resolution. What will they do, and how will it address what's happening in New York?
And first I wanted to make sure I shout out this awesome doctor's name, Dr. Eloise Chapman. Just want to make sure
Yes,
I shout her out. But and like you said, it is clear that the color of the skin is what is making the difference here. All of the studies say that. I'm sure we'll talk about some of that in our conversation. But all of the studies show it's really a race thing, and the fact that we know that and are allowing it to happen still. Um, I don't know which is worse. I'm trying to figure it out. But we're doing what we can here in the city, and my office. And this, as I mentioned, this legislative package we put in before this hit as close to home as it did. One is just a resolution supporting the Omnibus Act in the federal government. We have a bill to standardize how people are informed of their rights across hospitals. Sometimes you have people who want to listen to, who have to show out to get it, and then some people who feel intimidated because these are doctors, these are nurses, they're supposed to know. And you're feeling something, you're not sure if you have the right to, can you? We want to make sure that people are informed and have the information that they need. We also have a bill to reorient people after parental leave when they come back to work. We found that people will take the leave if they are privileged enough to have it, but when they come back after giving birth, after taking some time with their child, their career sometimes might have stalled. And
that's
we
right.
want to make sure that people are reoriented to come back to the space to pick up exactly where they left off. And in the Senate, there's a Senator Myrie and Assemblymember Jackson have an act that creates hubs in Kings County and the Bronx to help service providers and health professionals coordinate maternal health care. And the Bronx and Brooklyn, we know, have some of the highest rates of maternal and infant mortality.
I'm so glad that you mentioned the Momnibus and the importance of us to invest in like a care infrastructure and the connection that there is to paid family leave, right? So, like, in addition to being one of the worst places to give birth in the world, of the developed world, there's also this situation where the United States also doesn't have a national paid leave program. So in some states, in many states, a woman can have a C-section and need to be at a cash register a day or two later. We know that jeopardizes her life. There's all of these things that we know kind of connect what's happening with having this lack of a care infrastructure. So that's really powerful that this package of bills brings together, push the federal piece, the Momnibus, and big shout out to Congresswoman Underwood and Congresswoman Adams, who are the co-conveners of the Black Maternal Health Caucus, which is the first ever like that in Congress, who are pushing these packages of bills, but then connecting that to both having access and making sure you can care for yourself. This is a major event that you've had when you've given birth, however you've given birth. And you need to be able to take that time, not just to bond with the baby, but to heal from the process. So, thank you
No,
for that.
that's a hundred, 100% correct. And I also always want to mention, we always recognize, my wife and I, India Sneeze, shout out to her, our own privilege, because one, we had jobs that we can actually take off when we
Right.
needed to deal with this. As you mentioned, if you had to be a cash register, you had to be somewhere where if you take off, you lose money, you simply can't do it. We also are privileged because we had health insurance where we could actually go get a second opinion or a third opinion and not have to worry about how much it was going to cost to do that. Those things are, I just want to acknowledge, on top of having to deal with the racial impact that it had here, the intersecting of, if you don't even have these things, or you might be an immigrant or undocumented, that compounds it even further. So I always want to make sure I acknowledge the privilege where we have it, so that we can speak about folks who don't. We're also happy, as you pointed out, the time that's needed to help recover. And, I'm sure you'll talk about the New York State's maternal health report that just came out. But we're excited because the one thing they are doing is trying to extend health insurance for 12 months, so people can have more time after they give birth. But that same report, which is scary, 78% of the deaths were preventable, and 100% of the deaths caused by hemorrhage, mental health conditions, and others were preventable. 78% to 100% of the deaths were preventable, and 46% of the discrimination was identified as a probable or definite circumstance surrounding the death. These are astonishing figures that are known. And I felt like a reporter asked me about this. I think it was Ayanna Harry, actually, has been covering this in Channel 11 pretty well.
Mhm.
But and I'm like, many of us, and especially people like you, Monifa, and Moms Rising, have known this. So it's good to get additional reports and data to back this up. But what's needed now is action.
Absolutely. And we need action at every level. We have our champions, but we need to move everyone who's in a position of power. The preventable piece that came out of the report is the part that is so heartbreaking. Because again, not only is it preventable, we also have the resources to address these issues, but are not putting them in place to prevent these deaths. And we know that discrimination is there because even when we travel outside of our communities, we tend to feel like, well, you know what, I'll go somewhere else and get care because perhaps the care will be superior.
Yeah.
But what you can leave your neighborhood, but you can't leave your Black body.
Mm.
And so some of the cases that we've worked on nationally where Black women actually went to the best hospitals in those cities and suffered grave consequences. I think of Kira Johnson. We have stories of women in Florida who did the same, traveled and received their care in the counties where they knew outcomes were superior, However, their outcome was still inferior as Black women. So we've got to address that head on. And we thank you so much for addressing that. What are some of the other things that you have seen? I saw that you led several press conferences, in fact, and rallies with families based in our very own Brooklyn. What are some of the things that people on the ground are demanding, and what are some of the stories that people really need to know across the country?
One of the big things, as you mentioned, to make sure the infrastructure that's there, that includes having birthing centers, that
Mhm.
includes having doulas accessible and able to operate here in a way that they aren't, and funding for all of those things. We want to make sure we have access to high quality, comprehensive, community based health centers that are actually culturally competent as well. Um, these are not things that are far fetched. These are things that we know help, uh, and it's just about elected officials having access to them, and making sure that we have services for mental health when people are going through these issues. We definitely want to make sure we, don't leave out our gender nonconforming and our transgendered New Yorkers who need assistance as well, making sure they have culturally competent assistance for their services as well. But if we can build out the networks for those, but if we can build out the infrastructure for those, it would be so helpful. Obviously, if we had universal health care, it would be a lot better. We'd have access to all of these things, like is done in so many of the other developed countries we spoke about. But
Look, we're
these are
chipping away at it. That's what we're pushing towards.
yeah,
People out there need to know we push these policies and these bills, whether it's the Momnibus or it's the birth equity package, but there's a North Star that we know we need, which is really healthcare for all. But go ahead. What were you about to say?
no, I mean that's it. And what's always just annoying at the end of all this is the reason we don't have a lot of these things is just money.
Mhm.
Somebody's making a lot of money with us not having universal health care, and it's so unfortunate.
Yeah.
And we just also need people to do better at recognizing their own unconscious bias. We all have it, and I think we got to have this conversation in a way that people can acknowledge that, and I guess be called in as opposed to be called out. Because the more we kind of hide this unconscious bias, the worse it is. You have doctors literally coming out of med school saying they think Black people have thicker skin. That is
Yes.
obviously a problem. And having it in there, if you're not taught how to acknowledge and move it forward and remove it, people literally die. And it's
Yeah, one of our Brooklyn homies, Dr. Uche Blackstock, I just saw her tweeting about that they're still being taught that Black people have different kidney functions,
mm,
which is not true. And there's different things that are still being taught that need to be done away with. And you kind of just discover it here and there. You go someplace and they're like, wait, this person's not qualifying for this organ because people are still being taught that they should look at the numbers differently if the person is Black. All these things contribute to death. And they also chip away at our mental health. So you talked about the mental health, maternal mortality deaths. And I actually just recently, I want to say now it was 2 months ago, found out a stat that blew my mind because we've been working on this for about 7 years now. And we look at hemorrhaging, like you said, mostly preventable, preeclampsia, high blood pressure during pregnancy, mostly preventable, as being the kind of leading causes of maternal mortality. But actually, when you pull in all the stats for postpartum depression, and postpartum suicide actually exceeds those stats, really making it the number one cause of maternal mortality. And I think it's important for everyone out there listening is that when you're experiencing this type of discrimination, whether it's in the hospital, in the street, at school, it weathers your body and your mind, right? It eats away at your mental health, the way that we are interacting with these systems that are supposed to save us. So thanks for highlighting that because I think the maternal mental health piece gets lost a lot.
it does, and I didn't even realize that it eclipsed the rest of it. I knew it was an issue, but thank you for highlighting that. And I think those of us who have a little bit more melanin in our skin, we know we've learned to deal with the society and how it views us, and we also know it does take a toll. We've learned how to
Mhm.
deal with it for the most part, but we have a lot of mental health issues in our own communities that we have to deal with. But I can't imagine what that's like in a time of your life where uh, you're trying to give birth and not being listened to, and so much is going on right at that acute moment in time, not being listened to, and hopefully you get past and are able to give birth and trying to take care of this beautiful child that you have, and don't have access to the things you need to be in a safe and healthy environment, and what that constantly will put pressure on you. And then not, postpartum
Then
depression
you have postpartum depression. Yeah.
is a known thing, and now you've been dealing with all of that, and maybe you have postpartum depression, and then you have nothing to assist you with that. That's a lot to ask a human being to have to deal with, and a partner that's trying to work with them as well. So it's important, and it's sad. When I was in the living room, my wife, we had to have a C-section. They recommended because of the cervical cancer, but it got scary in there. And when they took the baby out and she started feeling a little pain and stuff, and
Yeah.
you know, just
Yeah.
started thinking about some of the stories that I heard. Man, I can't even understand how. I think about even the partners and survivors. What It's just incredible trauma that gets passed and
Gets passed
overlooked
on
for,
and on and
for
on.
so long.
Yeah. Well, one of the things that I always like to focus on and wrap up with is hope. You know, we're out here on the front lines, everyone listening, not just because this is a serious issue, but also because we know we can win, right? We know that we can map out a better future for my daughters and for your daughters, right? We're here fighting so that when they come to a point in their lives, if they want to have children, if they choose to become parents, that they will have a different experience. And that's the legacy that we come out of, right? Like we are experiencing the world in a way that is, however, 100 times better than our ancestors, and the things that they did basically made way for us to have these better experiences. And so now we're continuing that fight. When we look at who is really breaking ground on this, again, shout out to all of the Black doulas, Black midwives, and you shouted out your OB, who's also oncologist. We are finding that our community is creating the people that we need to solve this problem in our legislators and in our healthcare workers. And so we got to continue to invest in that and push your legislation along as much as possible. What can people do to support the Birth Equity Act?
First, just to the point you raised, I just want to acknowledge the work you, Moms Rising, and other people have done, because probably 5, 10 years ago, we'd still be at the point of trying to get people to believe that this was happening.
It was an issue, yeah.
So it's sad that we even have to count that as movement, but at least now that no, it's indisputable. Everybody knows that this is a thing, and that
Mhm.
we have to address it. Our bill was in the city council last session. We're hoping that we can get it. We tried to get it done before the end of the session, and we just couldn't. We have a brand new host of council members and a speaker that we think are going to be interested in this. And so
Okay.
it's really speaking with your local council member, pushing it out on social media with your groups, that this package of legislation is already there. We'd love to see it pass as soon as possible, and pushing that in the council with if you have connections with the speaker or your council member in particular, if you push it out on social media, those things really have an effect and really have an impact. And I'm proud of the work that this council is doing now. And I'm looking forward to this package getting passed as soon as possible.
Well, for everyone listening, we're going to pull the links to those bills, and we're going to put on our Moms Rising website how you can push the birth equity package. And we also want everyone to sign our petition to support the Momnibus. That's the Black Maternal Health Momnibus. It's a package of 12 bills that does many of the same things that our public advocate Jamani Williams talked about the birth equity bills do on the local level, but think about it on the national level, expanding Medicaid to covering a full 12 months postpartum, putting in some provisions around taking care of people who are experiencing postpartum depression and maternal mental health issues. And so all of that is wrapped up in that package around the Momnibus. We're going to drop that link for you to sign on there. And then we're going to make sure that as you sign up there, you'll get the links to how to support what's happening locally in New York City. We've got to kind of be firing all on all cylinders here because we know even when we pass things on the federal level, it doesn't necessarily trickle down the way you want on the local level. And also, when you pass things on the local level, it doesn't impact women across the country. So we really have to come at it from both ways.
That's
So
absolutely
I
correct.
want to see if our backstage has any questions that have come up in the Facebook chat or on YouTube for us. Bring it on to us. But what else would you like to let folks know that is happening or moving in New York? And I also want to shout out the families really quickly, though, as we wait
Yeah.
for some questions. Just like with all issues, you know, it always amazes me that people who have suffered the most end up creating the systems that prevent other people from experiencing those tragedies. And so we have some families, people know nationally about Kira Johnson, but right here in New York City, there's some families that you've been working with who had experiences here in Brooklyn and I believe uptown.
Yeah, there's a lot of families, and we got to shout out to all of them who have shared their pain. As I mentioned, I can't imagine what that pain was like going through, but they've turned their pain to purpose. We've seen that have to happen on a number of issues when it comes to Black and Brown communities. You know,
Mhm.
just a sidetrack, whether it comes to gun violence or police violence to Black maternal health. Our community has had to, unfortunately, have an amazing ability, um, a God given ability. I can't think of it any other way to use that pain of losing someone, particularly losing someone that was preventable, uh,
Yeah.
to then take that pain and really push it into purpose. And it's their stories that I think have helped get us here, being able to
Yep.
humanize and make sure we don't forget their loved one, and pushing forth their loved one's story and what they're going through and the struggle and trauma that they've gone through. Also, on behalf of the children who are still here, just shout out to all of them because, you know, as much as we have to celebrate the little wins, like people acknowledging this is a thing, that probably wouldn't happen without those
It
families.
would happen without those stories. And for everyone listening, when you able to take action to reach out to your member of Congress and also your city council member, we always ask you to share your story. And that's because when we go and we meet with elected officials with data reports and numbers and charts, it's not real. It doesn't really land in the way that it does when you say, and also here are 12 stories from your constituents and what they experience. You know, those are the things that really move the needle. I was just watching a commercial, in fact, about Emmett Till's mother and the movie they made about Mamie Till, right? And how her sharing that story and pushing the story of what happened to her son became a big call to action nationally, not just where it happened in Mississippi, not just where she was from in Chicago, but because she was like, open the casket, share this story. You will see and hear and feel my pain. And it was very powerful. So, infinite thanks to all those families. And it's working. It does move the needle in ways that the data alone really doesn't get a blink at all. So we're going to go ahead and wrap this up because, as everyone in New York knows, our public advocate, Jamani Williams, is a champion on many issues. He was running in here to talk to us now on this issue, and I'm sure running out to address so much more that's happening in our city, that in our city, of course, impacts the entire country. So thank you so much for joining. We hope you come back again for one of these chats.
Thank you. Yeah, absolutely. Thank you so much. Peace and blessing. And just thank you, just thank for Rain making sure we shout out Amber Rose, Isaac, and partner Bruce McIntyre, one of the families who's been working with us as well. But thank you so much, Manifa, Moms Rising, and everybody who's been working on this issue. I really, really appreciate it. And I appreciate just being able to use my office and use our story and my wife India story and our whole family. It's just an honor. And thank you for inviting us.
Shout out to your daughters. Shout out to everybody out there. Share, definitely take action on our website. Share your story, and we'll be back with more on birth equity and maternal justice. We're going to be talking to Black doulas and midwives and everyone who's saying this is what needs to happen from top to bottom to turn the ship on this. Thanks for coming, and we'll be back. Peace.
Peace.